Good afternoon. This is Mayor Jerome Prince with the City of Gary's COVID-19 update for April 24th, 2020. As you know, we remain under Indiana Governor Eric Holcomb's stay-at-home order. We continue to support the governor's order, and we are closely monitoring all federal and state guidelines regarding the COVID-19 pandemic. Like the rest of you, we are awaiting the governor's next decision on the stay-at-home order. We have reason to believe that the governor will gradually release or at least relieve us of some of the restrictions on business and travel. But until the end, we must remember that everyone has to contribute to the safety of all of our residents, which includes adhering to the stay-at-home order, making sure that we adhere to the social distancing order, and by all means limiting travel to only necessary trips. If the governor does lift the stay-at-home order, we expect that more people from the state of Illinois will actually come into Indiana to conduct their business. If that happens, it certainly will increase the chances of our exposure to the virus, because we know that Cook County, Illinois, is designated as a hotspot. To that end, we must continue, as I said earlier, to continue to practice social distancing and to keep people from traveling from places that they don't need to be, and also be cognizant of the folks that are traveling in and out or throughout the state. We're getting a clearer picture of how this COVID-19 virus actually is affecting our residents, thanks to the information that's supplied by our statistician, Martin, from the Gary Sanitary District, Martin Brown that is. We have very up-to-date and accurate numbers, and they are as follows. About 1/3 of our positive cases are in the 46404 zip code area. These areas stretch from Grant Street to the east side of Clark Road on the west, and from the Indiana Toll Road on the north to the Little Calumet River on the south. That would be the Grand Calumet River on the south. We also know that 60% of our positive cases in Gary are in the 40-year-old to 70-year-old ranges. Finally, we know that about 51% of our positive cases are among women. We have proof that the virus continues to spread throughout our city. We can and must do more to continue to do our part to help stop the spread of this virus and to avoid in-person gathering of more than 10 people at a time. I'm also joined today by a few members of the community from various cross-sections. Today we have Dr. Paige McNulty, the emergency manager for Gary Community School Corporation, who will share some updates relative to education. She'll speak shortly after Andy Quinnell, who's here with us also. Andy's project manager for NISA, which is located at our airport. But next, you'll hear from our very own health commissioner, Dr. Roland Walker, with some relative up-to-date stats. Dr. Walker.
Thank you, Mayor. It's always a pleasure to come and speak to the citizens of Gary. A couple of housekeeping issues. One, I had a message to my daughter today, actually. My daughter woke up this morning, she's trying to help me celebrate my birthday today, and I wanted to let her know today that I am postponing my birthday due to the coronavirus. It is postponed until further notice. Also, what I wanted to do today is talk to the citizens a little bit about what the coronavirus does. And so I was speaking about this earlier today on the radio, and why the virus seems to disproportionately affect African Americans. What we found is that this virus actually does deal a lot with water retention with the angiotensin II receptor. Now, I don't want to go into a lot of wonky detail because this happens to have been an area of research that I did in college, but essentially the African community selected through evolution in an area of being able to retain water in areas that did not have a lot of water. And so that is why you see elevated blood pressures in our community and why you see hypertension in our community. And so what we found is some of the medications that are diuretics have been shown to help in treatment of COVID, pneumonias, people on ventilators and that sort of thing. And so that's why I think you're seeing a lot of the disproportionate amount of deaths in the African American community. I bring that up today because a lot of times we speak about some of the social things that are involved with comorbidities and increased comorbidities and increased deaths in the African American community. But I wanted to bring a scientific part to it, too, a biological part, so everybody can understand that sometimes some viruses can be more detrimental to people than other people. So today I want to tell you a little bit about the Indiana numbers, as we normally do. And we'll find today that in Indiana now there are 13,680 new cases, total cases in Indiana, and unfortunately there have been 741 deaths in Indiana over this period of time. In Lake County, we're seeing a total of 1,445 cases in Lake County, and unfortunately, once again, there's been 63 deaths in Lake County. Now, in Porter County, we've actually seen a total of 204 cases and 5 deaths. Moving on to our local numbers in Gary, Indiana, unfortunately, now we have seen 11 deaths in the city of Gary, and we're praying for those families who have been affected. We saw 30 new cases, and now we have jumped up to 344 cases in the city of Gary. And I say that because I've noticed a pattern. And that is, when we come out of this weekend, we're going to see those increases look a little smaller. And I want to just caution people to say, hey, we're flattening the curve, because I think that at the end of the week and the weekend, where a lot of places are not testing, we've noticed those numbers go down. And then when you start testing in the beginning of the week again, you see those numbers go up. So at the end of the week, we see these large increases. So that's why I think it's really important, before we start celebrating and say, hey, we flattened the curve and it's time to really start moving to widespread reopen things, that we look at a couple of weeks' data to make sure that we have a good flattening, and make sure that it's safe to do the things that we need to do around in our area. Like as the mayor spoke of earlier, Illinois has decided to remain closed until the end of May. So that's why I'm going to caution everybody here to continue with social distancing, as you're going to see an efflux of people coming over from Illinois into Indiana. Social distancing will really help to blunt that effect, and we will then come with some recommendations coming forward to help us deal with the reopening of certain areas near us. Thank you once again, and the mayor will now return to introduce.
So next we're going to hear from Andy Quinnell. As I said earlier, Andy Quinnell is the project manager for the Northwest Indiana Information Sharing and Security Alliance, also known as NISA. This is a public-private partnership established to share security, preparedness, and resilience information across the 5 counties in Northwest Indiana. Andy?
Thank you, Mayor. Just to give a little background on NISA, NISA was founded out of the 2008 floods because we saw that a lot of communities were operating in their own little silos instead of collaborating together, at which time, you know, the U.S. Attorney and U.S. Steel got together because U.S. Steel, as we all know, was not able to ship any steel or ship anything in because the Borman was closed. So we got together and it became a shared resources organization. What they did was, between the public and private sectors, they went together and they created a program so that we would know what everybody had in their inventory. Everything from, as we all know about PPE, to, you know, pumps and different equipment like that. You know, we've run a lot of little tests. We've never really had to do anything. Then on March 13th, exactly 6 weeks ago today, we decided it was time to stand up an emergency operations center with the District 1 hospital group, which includes 17 hospitals in the 5-county area, which is Lake, LaPorte, Jasper, Porter, and Newton counties. The mayor was approached and asked if we could utilize the terminal at the Gary Airport, and he was very gracious and forward-thinking and, you know, allowed us to use it. And since then, we have actually taken in over $1.5 million worth of supplies. Between PPE, the mayor was out on Saturday, we actually brought in 34 ventilators that were created by GM and Ventec out at the Fort Wayne plant. We also today received 34 55-gallon barrels of hand sanitizer that is going to be distributed to the 17 hospitals and the first responders in the district. So we are working diligently on a daily basis to try to support the 17 hospitals and the first responders in the, you know, in this 5-county area. I have to tell this, the residents of Gary, we can't thank Mayor Prince enough for all he's done. He has become a leader not just for Gary, but for the entire region. So we really appreciate that, Mayor. Thank you so much. And you know, I'd like to say we have a model here that's working. You know, proof is in the pudding. You can ask these 17 hospitals. Your own Gary Northlake campus went black on PPE, and we were able to get them PPE within 30 minutes. So we are, this model works. Again, thank you so much, Mayor Prince.
Thank you, Andy. So next, we'll hear from Dr. Paige McNulty, Emergency Manager for Gary Community School Corporation.
Thank you, Mayor. Good afternoon, everybody. And I wanted to take a few minutes to update our parents and our students on some updates on what's happening within the school corporation. I wanted to make sure that everybody knew that the last day of school for us this year is going to be May 29th. That'll be our last day of e-learning. We will continue to have e-learning 3 days a week as we have been, which are Tuesday, Wednesday, and Thursday. Monday and Wednesdays will continue to utilize the governor's waiver days. So 3 days of e-learning from now until May 29th, which will be our last day of school. In addition, students who are in grades K through 8, we are going to be utilizing a pass-fail grade for those students for the fourth quarter only. You still need to keep up with your e-learning work. That's how we're tracking you in our computer system. If you're logging on and doing your work, we can see that on our end of the computer system. You need to log on and continue on, and you guys have been doing a fabulous job submitting those assignments with your teachers. Please continue to do that through May 29th, and again, K through 8 students will get a pass-fail grade. Students in the high school, however, will continue to get a letter grade, and that's really important that you understand that, seniors and high school students, because it's important for those students who want to go on next year, perhaps for IHSAA rules, you have to have a letter grade. Also, if you're going on for post-secondary reasons, on for vocational, you have to have a letter grade. So please make sure, high school students, that you are logging on and continuing to submit those assignments that your teachers are working so diligently in posting on our website daily so that we can ensure to get you those grades. I also wanted to let you know we will not be holding any on-site summer school this summer for obvious reasons. We will be doing summer school, however, virtually, again through e-learning. And that is going to start June 8th and will go to July 1st. We will post all of this on our website, but I wanted to make sure that the parents heard this today. It's June 8th through July 1st. And we have already been sending out through the mail summer bridge workbooks that the students can use and parents can use as an enrichment resource so that your students can keep up academically over the summer so that they're more prepared to start in the fall when we come back to school. So please look for a mailing that we have sent home to all parents and students, a nice big book with all sorts of stuff in there for math, reading, science, etc. In addition, we will not be holding an in-person graduation ceremony at this time. We certainly want to salute all of our graduating seniors. We feel very badly that we can't do it at this time. We will plan on having something for them in the future. We absolutely want to celebrate their successes. We plan on doing that at this time through yard signs, putting their pictures on channel 21 and 22, doing some billboards, things like that, so we can certainly tell them what a great job and how proud of all of them we are. And then hopefully we can do an in-person graduation in August. So please stay tuned again and look to our website for further information on that. We are going to continue our feeding distribution. That's going very well. We've been sending out between 5,000 and 7,000 meals every Monday. Please continue to look for the buses at the bus stops, and we'll do that all through the summer. So if you have any questions or if you're missing those sites, the phone numbers are live on our website. You can reach out to somebody, and we will bring food to you if you need assistance. So please reach out to us. I want to continue to thank all the parents, students, and teachers, and the mayor for his leadership. This has definitely been a team effort. I'm asking students, I know it's getting warmer outside, but please stay home and stay safe so that we can all get back to school in the fall and continue on with the great activities that we have planned. So thank you. I appreciate you letting me be here today, and thank you for your leadership.
So just a few points. Certainly, we're in unprecedented times, and to that extent, the importance of collaboration, teamwork, and creative thinking has certainly been a necessary and valuable tool in our addressing this pandemic as a city. I am appreciative of efforts of Dr. McNulty on the school side, certainly Andy Quinnell and the NISA organization in making sure that our first responders and our medical community have the resources that they need. It's certainly just been a privilege to work with so many folks. I'm especially pleased to work with the talents of our health commissioner, Dr. Roland Walker, largely because since the beginning of this pandemic, he's been at the forefront of trying to keep us abreast of the latest trends and stats that are associated with it, but also attempting to share accurate, up-to-date information with our citizens so that they could be well informed and ultimately keep ourselves safe. All of you are certainly appreciated, and as we continue to address this pandemic, I certainly am going to continue to rely on your expertise, your wisdom, and certainly your effort as we continue to address the pandemic. In closing, I want to mention a good news story, and certainly there are those that continue to occur. One of them is that through the efforts of Dr. Walker, we're going to be able to realize more testing opportunities here within the city. As you know, the testing facility at St. Timothy continued to operate throughout this week, as well as we're establishing a drive-up testing site at the Gary Health Department soon. In addition to that, Dr. Walker has been in direct contact with the state and has convinced, or at least stressed the fact that we would like to test every citizen in the city of Gary. I think the data and the numbers that are related to this suggest and would verify and substantiate that testing is critical to our understanding the trends and how we can better address the spread of the COVID-19 virus. So Dr. Walker, we certainly thank you for your efforts, and we will continue that. Another good story, a little bit closer to home, is one of our volunteer employees, Mrs. Dorothy Hall, who works at the reception entrance in City Hall. At the end of March, Mrs. Hall was diagnosed with the COVID-19 virus. She became extremely ill and spent weeks in the intensive care unit. And there was actually a moment where her family wasn't sure exactly what the outcome was going to be, and they were at least notified that they should possibly consider making alternative arrangements. We're pleased to report that with a strong resolve and many prayers from families and friends that Mrs. Hall began making progress, and to that extent she's certainly getting better and expected to be released here very soon. In fact, as soon as next week, and her family is planning a great celebration for her. So I, for one, have gotten to know Mrs. Hall over the last 100 days or so, and she certainly was a great addition to the city of Gary, and we would be absolutely ecstatic to have her rejoin us here. I wish her all the best in her recovery, and I'm certainly excited to hear and deliver that great news. I also know that we're asking a lot of our Gary residents, but as I said from the beginning, this is a collective effort. The orders for stay-at-home and social distancing were executed through the governor's executive order, and as a municipality, not only is it a responsibility for us to help keep our citizens safe, but it's certainly a responsibility of ours to make sure, or at least to do everything we can to make sure that people are adhering to the laws of the land. And to this extent, it saves lives. So I want to continue to encourage you to practice social distancing, stay at home unless the travel is absolutely necessary, and remember that we can and will get through this together. Thank you very much.